Issues are framed as assets whenever possible. The absence of an asset would be a risk factor when flipped around. Sensitive questions were asked farther down in the questionnaire, so we weren't going to ask somebody about their sexual preference or about their health status or substance abuse right at the beginning of the questionnaire. That would be happening later on as they became more engaged in the process. And then the final set of questions really were only asked of those or individuals that would fit for that category. So if you're a female, you'd be answering another series of questions for that group. If you're a youth, you'd have another series of 7 or 8 questions that you would have to address. So for youth, we asked an additional 12 questions that were regarding current safety, their family structure, who they're living with, the risks that are embedded within the family that they're living with at that point in time. Were they experiencing conflict, abuse, neglect, or bullying within the family? And again, from the literature and from your own experience, these are all things that are very much in describing the youth population. For adult women or mothers, we asked 8 questions about sexual or physical violence, whether they experienced recent separation within their living situation, a conflict, or have a child welfare contact for their own children. For older adults, we looked at 6 questions about worsening of physical and mental health concerns, abuse within their living situation, housing risks, or adequate supports. And for Aboriginal participants, we asked an additional 5 questions about a history of conflict, abuse, residential school, and transitions to and from different reserve settings that they might be living in. There's some caveats and concerns about this. One is it's based on research from across the globe. Does it actually translate well to Calgarians as we understand the process for that? Some subgroups have got little research comparing the hows to those that are definitely homeless, and the heart's not ready for use to predict those at risk of homelessness. It really needs validity testing to occur over the next period of time. The next steps would be that we're doing pilot testing with about 700 different individuals that are participated in total, and these are happening in community-based agencies throughout the city. As we talked about all the different participant groups that we wanted to involve that was identified in the literature, we also completed the HEART tool on laptops, as I've talked about, using SurveyMonkey. Everybody would receive a participant's card for participating, and at that point in time that we would ask them a series of questions about whether they would agree to be involved in a follow-up contact down the road. And if they said yes, they would provide some contact information where they're living right now, but also contact information about where they could be contacted if they disappeared. So who would you phone? Do you have cousins, relatives, people that would be appropriate to contact in that way? We also had to make sure that we paid attention to protocols about contacting people that would it be appropriate to leave a message, for example. And if so, what should the message say that would allow them to know that they should get back in contact with us? So I think we've set up a fairly good process for going through that. And phase 2 will follow about 175 individuals over a 2-year period to then track their housing experiences and to assess this instrument's ability to predict future housing and experiences that they might be running into over that period of time. Again, the purpose behind this is really to help service providers at a much earlier state than where we're all involved right now around the table, but those people that are involved in working with individuals and adults and older adults in anticipating those that are at highest risk, and how could we provide something in a different way that might be more useful at that point in time for the individual. And with that, I'm going to end. So thank you very much.